feel free to help yourself to any first food that there is. And I have a jar for Relay for Life that I'm going to send around, so if you have any loose change or bills, just put it in.
Okay, so as Sarah said, I'm Emily Bergsma, and I titled my presentation What Cancer Cannot Do, and I'll explain that a little bit more at the end. So first, a little bit about me. I grew up in Pennsylvania, outside of Philadelphia, with my parents and my two older sisters, and I lived there for my first 18 years of life. And my dad's the one who really got me interested in pharmacy because he was a vice president of GlaxoSmithKline Pharmaceutical Company, and he worked with a lot of research pharmacists. And so during my junior year of high school, he encouraged me to look into pharmacy as a career, but I wasn't really sure what I wanted to go into yet. So in June 2010, which was at the end of my junior year of high school, on June 2nd specifically, I was cramming writing a paper for my AP US history class, and I had spent 6 hours writing it, and my neck was really sore. And so I was giving myself a neck massage to relieve the tension, and I realized that the left side of my neck was significantly bigger than the right side. And so I went and had my parents feel it, and my dad said he really wanted me to go to the pediatrician the next day to get it checked out. And so I went to the pediatrician, and he had me get an ultrasound of my neck, and I could see that there was this large oval mass in my neck. And so he recommended that I go to an ear, nose, and throat doctor to get checked out. And the ENT made me inhale this stuff that made my nasopharynx numb. And then he stuck this camera that was on a long tube up my nose and down the back of my throat, and he looked into it and saw that the mass in my neck was restricting my breathing a little bit. And so he had me admitted to the local hospital, which is actually the hospital that I was born in, to stay for a night. And they did a CT scan, and then from there the next day they recommended that I be transferred to a specialized children's hospital. So I decided to go to DuPont Children's Hospital in Delaware because we lived right over the border from Delaware. And I stayed there for 3 nights, and they took a lot of blood and were trying to rule out infectious diseases because they were hoping it was an infectious disease that was easily treatable compared to cancer. So after the 3 days, they let me go home and said they'd call me with the results. And they called and said all the results were negative, and they wanted to schedule a biopsy of the mass and a bone marrow aspirate for the following week. So I had that done, and then they called and said that they wanted me to meet with an oncologist to get the results. So at that point, I knew for sure that it was cancer, and when I found the tumor, at first I thought it would probably be cancer. So it ended up being from I ended up spending the 2 weeks before I got my diagnosis doing research into I knew it was lymphoma because it was an enlarged lymph node, but I wanted to know what type it could possibly be. And there's 2 main types of lymphoma. There's Hodgkin's and non-Hodgkin's, and Hodgkin's has a 90% survival rate, and non-Hodgkin's only has a 10% survival rate. So for those 2 weeks, I didn't know whether or not I was going to die. And so those were the 2 hardest weeks of my life up to that point. But I had been raised in a Christian home, and I had chosen the Christian faith as my own when I was in middle school. And so it was at this time that I really chose to rely on God to that He had a plan for this, whether or not I was going to die. I knew that He would work it for good, and so I ended up having an overwhelming sense of peace with whatever was going to happen to me. And so I went into an oncologist with my parents on June 16th, and they told me that I had stage 2A bulky Hodgkin's lymphoma, so it was the more treatable one. And it was stage 2 because it was not only in the large tumor in my neck, it had metastasized to the lymph nodes around my trachea, but it hadn't spread to my bone marrow or to the lymph nodes in your armpits or below the diaphragm. And so they said I had to start chemo as soon as possible, and they gave me a lot of different information about my chemo drugs, and obviously I was scared to receive the information, but I was also just really fascinated by how the drugs could possibly cause all these different really scary side effects. like how they work in the body. And I ended up just showing my friends all that, and they thought it was just like really strange that I thought it was like kind of cool. So June 18th was my last day of my junior year of high school that year, and so I knew I was going to lose my hair, so I tried to take as many pictures with friends as possible, and those are just some pictures with two of my friends. And then 3 days later, I got my portacatheter in and started chemo. So a portacatheter, if you don't know, I have like an example here. This wasn't like the one that was in me, obviously, but this is just an example they gave me so I could like explain it to people. But it's basically like this metal, like little circle, and they made like a cut in my chest, and then slid this like under the skin, and then they have little holes around the edges of it that they use to like tie to your heart, like the tissue like around your heart and the muscles. And then they like seal, and they use this tubing to insert it into like one of the major veins going into your heart, because you can't give chemo to peripheral veins because it'll kill them. And then they closed it back up, and then whenever they needed to give me chemo or like anything, they would put a needle into my chest and then have it go into this little circle of silicone, so that when they took it out, the silicone would just like reseal from the needle, so it wouldn't like bleed into my chest. But every time they accessed it, it like felt like I was being stabbed in the chest by this like wide gauge needle, because it needed a lot of like force to get through the silicone. So I wanted to pass this around so people can, oops, yeah, so people can kind of see what it looks like. But yeah, so my chemo involved, it ended up being like 4 3-week cycles that were like spaced out by like 21 days, and I would get chemo doses on days 1, 2, and 3 of every cycle, and on day 8. And days 1 through 3 were inpatient, and then day 8 was outpatient. And on day 1, I would get one of each of these drugs, doses of each of these drugs. On day 2, I would get 3 doses of drugs. On day 3, I would get 2 doses of drugs, all inpatient. And then day 8, I would get 2 drugs outpatient. And these are just, I wanted to give you just a little bit about the side effects I experienced from each of these drugs that I got. So doxorubicin is in a class of chemo drugs known as anthracyclines, which are known to cause heart damage. So I had slight damage to my heart, and then it's also red, so it caused me to like have red urine, which is like unnerving the first time. And also I had nausea and hair loss and low blood cell counts of my white blood cells, red blood cells, and platelets. And then bleomycin caused darkening of the skin associated with itching or scratching. So when on my first night of chemo, they before they gave me the chemo, they gave me ondansetron IV, which is an anti-nausea medication. And this made me really itchy everywhere, and it also gave me uncontrollable muscle spasms. And because I was so itchy, I kept scratching myself everywhere, and so everywhere I scratched that night, because I got bleomycin, it like turned into like a tan scratch mark that still hasn't gone away. So I have it like scratch marks in the backs of my arms and on my stomach and on my legs. And they said it would like go away when my skin regenerates within like 10 years. Also chills and a high fever at one point, loss of appetite, and then hair loss, nausea, and weakness. And cyclophosphamide was nausea, loss of appetite, hair loss, low blood cell counts. Etoposide was nausea, hair loss, weakness, low blood cell counts, and then also like a tingling sensation in my fingers and toes. So like the whole time I was in chemo, and a little bit of time after that, I had like pins and needles feeling in the ends of my fingers and like the pads of my feet. And then when I finished chemo, that like the nerve sensation, the feeling never came back, so I like don't have feeling there now. And then vincristine also contributed to the nerve problems. And then it gave me jaw pain and then constipation, and it also induced migraines in me that I've been getting since I was 3 years old. And I needed to take a lot of other drugs as well. One of them that I would get every day that I wasn't getting doses of chemo, I would get a Neupogen injection, and this is granulocyte colony stimulating factor, and it stimulates your white blood cells, or your bone marrow, to start producing blood cells. And my dad would give me this injection every night, and it was like the worst part of like both of our days, because one of the biggest side effects of the Neupogen was bone pain, and because it stimulates like all your bone marrow at once, and it would cause me to have like constant pain, at least in my legs, like all the time. And then for some reason on like day 13 of every cycle, it made me just be like completely in pain, like in every bone in my body, and I would just like spend those days like lying just like down ramrod straight and like not wanting to move at all, because it was like having muscle soreness all over your body, but like you can't just stretch a muscle and it feels better. It like hurt to like move your joints because you're like moving around your bones, and it hurt to have anyone touch me. And then I was also on prednisone, a total of 70 milligrams daily, and that made me have insomnia. It took me about like 3 hours to like fall asleep every night, and then I also had really bad heartburn because of it, and it made me gain weight as well. And so for the heartburn, took ranitidine and lansoprazole, and then they also gave me Emla cream, which numbs like the first 2 layers of skin. So I would put that on my port before they would access it, to try and like lessen how bad like the stabbing feeling was when they'd access it. And then they also, again, I said about ondansetron before for anti-nausea, and then lorazepam is like anti-anxiety, but it's also like a secondary anti-nausea medication. And then for the opioid and vincristine-induced constipation, I was on polyethylene glycol, Docusate, and Senna every day. And then they had me take Bactrim prophylactically, just in case like any bacteria were inside me, it would kill them, since I had no immunity when I was in chemo. And then also I had a lot of opportunistic like yeast infections when I had no immunity, and so they had me on fluconazole for those. And so after my first 3 days of chemo inpatient, I didn't have any like really adverse effects. I felt just like really dizzy and really sick to my stomach, because when they would put in the chemo through my port, it would immediately like kind of go to like the back of my throat and feel really hot, and I would taste like the chemicals. So that is what induces like the nausea, and you know, just feeling really weak and everything. But in general, I didn't have like any like horrible reaction. And so those were my 3 inpatient days. And then so when I got my day 8 outpatient chemo, it was like only 2 drugs, and I got to go home afterwards. So like I didn't think anything would be like so bad about that. And I got days like 9 through 21 of each cycle to like recover from like the effects of the chemo. So after I got the 2 outpatient chemo drugs, my mom took me out to lunch to like celebrate actually like being done the chemo part of the cycle and just like have recovery. But I started feeling just like really sick, and started to like sweat really weirdly, and then I started getting a migraine, and my mom just wanted, and I started getting like back pain too, and my mom like rushed me home and then gave me Tylenol with codeine, because I wasn't allowed to take ibuprofen for my migraines like I usually do, because it has some interaction like with the chemo drugs. And so I had never had codeine before, and so I didn't really know how it would affect me. And so that summer I stayed in the basement, because in Pennsylvania, like we didn't have central air conditioning in the rest of our house, and I needed like really sterile air too. So I stayed just in the basement where we had, it was finished, and it had its own bathroom, because I couldn't really share a bathroom with people because of germs. And it had air conditioning there, so it was like safe for me to stay there by myself. And so she like had me lay down for like a nap to like sleep off the migraine and stuff. And then she like left to let me sleep, and the codeine started kicking in, and it didn't take away my pain at all, and it ended up making me like unable to speak or move. So and I could tell that I was I was feeling still really nauseous and feeling like I was getting a fever. I was sweating a lot, and but I couldn't like call for my mom or anything. All I could do was like moan like a little bit, but she wasn't gonna hear me from like upstairs. And she had like left a phone next to my bed to like call her if I needed her, and I couldn't like yell or get up. Codeine also made me go like in between like a conscious and unconscious state. So when I was unconscious, I was having like these horrible nightmares, and when I was conscious, I was having like hallucinations, and I was like hallucinating that I was like sitting up and like grabbing the phone and like dialing my mom's number like for help, and then I would like flash back and realize like I hadn't moved at all, so I was just like trapped in my own body and like couldn't call for help. And eventually my mom, like a couple hours later, my mom came down to check on me, and she saw, like she finally could hear me like moaning, and like came over and like saw that I was bright red and like drenched in sweat, and she took my temperature and found that I had a fever. And like when you're in chemo, you're not allowed to have a fever because it could mean an infection of your portacatheter, or it could mean that like you're just having a really adverse reaction. So she rushed me to, she called the oncologist and they said to bring me in as soon as possible. So she rushed me to the hospital, and they accessed my port and took my blood. And it turned out like in the course of that afternoon, like my new blood sample had like 0 neutrophils in it. So it just completely like trashed my immune system in like a day. And it turned out that it was because the 2 drugs that I had gotten, which are bleomycin and vincristine, when they're given together, they have like a synergistic effect that increases each other's effects. So they ended up giving me morphine for 3 days, which had the same effects as codeine and didn't help with my migraine pain at all. So I was like just still having the hallucinations and everything. And then they eventually gave me Percocet instead. And Percocet was like night and day compared to like the morphine. It actually like took away all my pain and made me feel like really good instead of like horrible. And they also gave me sumatriptan for future migraines I would get, which worked really well. And then they thought that since I had like such a bad reaction, they wanted to try me on gabapentin in case I had some like nerve problem. But they eventually took me off of that. And so I ended up getting stuck in the hospital for 6 days because, like according to hospital rules, you can't leave or even like leave your hospital room unless your neutrophils are like above 1,000 in the sample. And mine stayed at 0 for 4 days, and then the 5th day they went up to like 52, which wasn't enough for them to let me leave. But then on the 6th day they went up to like 432. And so they said I could leave, but I had to like wear a surgical mask home to like prevent possible infection since I still didn't have much of an immune system. So that's how I spent like, that ended up being 4th of July that year, and I spent it like in isolation in my basement, just like feeling really bad because during that stay in the hospital my hair started to fall out as well. And that was probably the hardest thing emotionally for me to deal with, just because I felt like I wasn't like attractive without my hair, and it just was like I was really attached to it too. So that was really difficult for me. And after my first cycle was over, they did a PET scan and found that most of the cancer was gone. But after the second cycle, they found that like all the cancer they could see on the PET scan at least was gone. But the protocol is like finish the last 2 cycles just to make sure it's like completely eradicated. So it was really hard to continue after like the cancer was gone as far as they knew. It was harder each time for like my body to bounce back from like what I was going through, especially in terms of my blood cell counts. Especially like my red blood cells, each time it was like harder. I had like less and less like hemoglobin in my blood, and I was feeling like really dizzy and weak all the time. And it was like hard for me to like stay standing for very long because I would just get really lightheaded. And at the end of my 4th cycle of chemo, my hemoglobin, like according to hospital guidelines, the normal range is like 12 to 16 grams per deciliter, but for chemo patients, they try and keep it above 8, and mine is at 7.7, so usually the common thing is to give a blood transfusion at that point, but my parents were really hesitant to let me get that because there's such a great chance of infection, and I didn't have much of an immune system. So if the person who gave blood had a virus, then I could potentially die from it. So they kept asking the doctors for one more day to keep checking my blood a few days in a row. And so on Labor Day that year, I went to the emergency department to get my blood checked because the outpatient clinic I would usually go to was closed. And my hemoglobin was at 7.8, and so that was enough for them to see that my body could create enough red blood cells on its own so that I didn't need a transfusion. And so I ended up, the next day, I decided to go to my first day of senior year of high school. And I had decided just to tell my select closest friends because I didn't really want anyone to see me as different. So I didn't really want anyone to know that I was to treat me differently or to know that I was wearing a wig because I was really ashamed of that. And in general, I felt like people didn't really couldn't really understand what I was going through, and I didn't feel like anyone understood me and could really help me and in school. And I ended up bonding a lot with my 70-year-old English teacher that I had that year because she had seen most of her friends fight cancer or die from cancer, and so she really knew how to encourage me and show me empathy, and so that really made a big difference to me to have her there for support. And at the end of the middle of September, I finished my last cycle of chemo, and they ran a bunch of tests and determined that I was ready to start radiation. So radiation involved them making a mask that fit exactly to my face. So this was my mask, and basically to make it, they held hot plastic on my chin and then pulled it back and then held it to my face until it dried. And then they gave me 3 tattoos, one in the middle of my chest and then one on each side. And it was so that they could line up the radiation machine, the lasers on the radiation machine to my body because they wanted to make sure that they were only going to hit tissue that had been cancerous to make sure every cancer cell was obliterated. And they didn't want to hit normal tissue because it can actually induce cancer in normal tissue since it's such high intensity radiation. So this is what it looked like. Me on the radiation table looked like. So you can see my where it's bolted down to the table and the mask, and then they would close the shoulder clamps on to lock me in, and then I had to lay on my hands to restrict my arm movement, and then they'd open up my gown and line up the machine to my tattoos, and then the technicians would leave the room, and the machine would come down inches in front of my face, and then I'd have to sit like that for 15 minutes while they gave me the radiation. So that was really claustrophobia inducing for me. And I had a total of 14 radiation treatments, and it was 3 weeks. And I had to go there every day after school. And what most people don't know about radiation is that the side effects don't start until you're 3 weeks into treatment. And so I only had 3 weeks, and so it was right at the end that the effects started. And the side effects are a really bad sunburn, but it's a radiation burn instead, and also since it's hitting your heart and your lungs and then my thyroid, it made me just have really bad fatigue, and it lasted about 6 months afterwards. And I ended up getting my portacatheter taken out of my chest on November 5th of 2010, and I just kind of expected, every time I'd been sick before, you just, taking an antibiotic regimen, you just take it, and then when you're done the doses, you think you're gonna feel, fine again. But I learned, the hard way that cancer is, really not like that at all. I ended up having, fatigue for so long, and it took a year for my blood cell counts to get back into normal ranges. But my doctors told me that for some reason, especially like lymphoma patients, even though like the counts read normal values, your immune system is just like never the same. And then you also, for some reason, lymphoma patients tend to have unexplained fatigue the rest of their lives. And so that's something that like I struggle with still. And then in general, you just have to get like checked the rest of your life for like tons of other conditions that like chemo raises your chances for. So one program that my hospital did that really meant a lot to me was the Beads of Courage program. And so basically you get a bead for like every treatment you go through, and it's like matched to a certain color. And my string of beads is actually like my most prized possession. And I wanted to show it to you guys. It's over 8 feet long. Justin's gonna come up and help me hold it. And I'm just gonna run through like what each bead stands for. So beige is bone marrow aspirate, and white is for chemo doses, and then blue is for like outpatient clinic. So this would be every time I got my port access to like get outpatient chemo or my blood checked. And then silver is dressing changes. Magenta is emergency occurrence or like an ambulance ride. Brown is hair loss. Purple is an infusion. So this was like every time I got IV antibiotics in the hospital, which I got every day that I stayed there. And then yellow is for inpatient admission or sleepover at the hospital. Lime is for isolation or neutropenia or bed rest. Orange is for port placement. So it's like when I got my port put in. Light green is for scans. So it's for when I got x-rays, CAT scans, PET scans, pulmonary function tests, echocardiograms, and EKGs. And then rainbow was for care team visits. So I got assigned a specialized oncology social worker, and she would come visit me when I was in the hospital, and then also the child life specialist. And then bumpy beads were for self-infusion, so it's when I got Neupogen shots. But the hospital like ran out of bumpy beads like pretty soon into my treatment and didn't get like a new supply of them, so that doesn't accurately reflect how many bumpy beads I should have. And then black was pokes, so like every time I got my port access or an IV for some reason or another. And glow in the dark was for radiation. Star was for surgery, so getting my port put in, taken out, and then for the biopsy. And then handmade glass beads were for acts of courage, so they gave me one for like facing my diagnosis and like getting stuck in the hospital for so long, just different things like that. And then my favorite bead is the completion of treatment bead, which is a handmade glass purple heart, which Justin's holding. So this is a picture of me bald. It was taken in October of 2010 when I was going through radiation. And I know that cancer does like a lot of bad things, and that I've talked about so far, but I just wanted to talk about like the good things that I learned from it, and why I honestly like wouldn't take it back if I could, like having it, just because I learned so much from it. And so one thing that it really taught me was empathy, and it really gave me like a heart for cancer patients, especially pediatrics. And it really, it was like the drive that I feel like I was meant to have it to direct me towards dedicating my life to pediatric oncology pharmacy. And so that's like what drives me to, you know, work really hard in school and everything like that. And I feel like it'll make a big difference to patients and their families if they had a healthcare provider that can really like understand what they're going through and everything. And then also gave me an empathy for people in pain, because I had no idea that cancer patients like went through like chronic pain as they were going through treatment. And because I had to take like just to fall asleep every night to make the pain go away enough. I had to take like Percocet, and I got up to like where they like didn't want me to take anymore, and I just got like tolerant to it. So I just had to just lay there in pain and couldn't like do anything for myself. So it gave me like a huge empathy for people who struggle with that, with chronic pain for different reasons. And then also it taught me just a lot about like what beauty really is and how it's not just external. Just knowing that like it's really about like how much like love you share with other people and like the joy that you bring to the world and how you serve others makes you beautiful. And it also taught me about what true joy means, because I feel like because I went through like the worst that life has to offer, it helps me to really appreciate like I feel like a joy that I've never felt before I had cancer, just to like still be here and to be able to like pursue my goals and just to be so grateful for everything I have. That was like a huge lesson for me. That's really changed my outlook on life. And then also the importance of cancer awareness, because before I had cancer, all I knew about cancer was that you get nauseous and you lose your hair, and it's like so much more than that. It really like changes who you are as a person, and I feel like it's like part of my like mission to like share it with people, like what I went through, which is part of why like I agreed to do this when I'm not like huge on public speaking, just because I think it's so important that people understand how bad it really is so that they can help to like advocate for a cure for this deadly disease. And so one thing that really, the reason why I titled my presentation What Cancer Cannot Do is because someone gave me this quote when I was in chemo, and I really loved it, and it gave me like, made me really like feel peaceful during that time. So I just wanted to end my presentation by reading it to you guys. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot destroy peace. It cannot kill friendship. It cannot suppress memories. It cannot silence courage. It cannot invade the soul. It cannot steal eternal life, and it cannot conquer the spirit. So does anyone have any questions for me? Tina?
Like from the time you finished your treatment, how long did it take for your hair to grow back?
Well, you can kind of see it in this picture. This was October, and I'm like just starting to have like some sprouts come in, which radiation like lopped off like a little chunk of it in the back. But it ended up being like a month after I got my last like drug dose that my hair started growing back in, and it made my scalp like really itchy as it like the hair follicles were finally like awake again. But yeah, it took, I like have barely cut it more than just trimming it, and this is how long it is, like almost 5 years later. Any other questions? Jared?
What are the checkups that you have to go back for, and how often?
For the first year, I went back every month, and they would do, like I had to get like echocardiograms and EKGs to like assess my heart function, like every 3 months, and also a pulmonary function test. And then it transitioned. The second year it was every 3 months for all those things. And then when I moved down to Florida, my hospital here, which is All Children's in St. Petersburg, is a little less aggressive about like checkups. So I just go every 6 months now. And I have to do an echocardiogram, EKG every year, and a pulmonary function test every 2 to 3 years. And then once I'm 25, I have to start getting like breast MRIs every year, because I have a higher chance of breast cancer because of the radiation like hitting breast tissue, as well as like my family history. So it's like the rest of my life. It'll eventually go to like 1 year, I think so. Anybody else? I'm cool with any questions. Michelle?
Has anyone else in your family ever had cancer? Or?
we actually had no history of lymphoma, so it was just like really unexpected. We had like a lot of history of breast cancer, and then like prostate cancer, and yeah, but no lymphoma, so it was just like really unexpected. Anyone else? Tavish?
I know like some cancers, like I think if you reach like the 5-year mark, then it's like really good. Is that the case for lymphoma too? Or?
Yeah, for Hodgkin's, it was like the 90% survival rate that I was talking about was like over 5 years after treatment. So I think it's like it's officially considered like not in remission as of like this, I guess, June. It'll be like 5 years, so it won't be considered in remission anymore. It'll be considered cured. But there's still always like a little chance it'll come back. But I got like fortunate with the kind that I had. Cleo?
So, how did your parents and like close family members deal with the emotions?
Okay. Well, my dad had actually been like forced to retire from GlaxoSmithKline like the year before, and so he had been like really bummed about like being forced to retire when he was only like 54. So he ended up being like really grateful for it because like the whole time that I was like in chemo, like he like could barely sleep at all, and he would spend the days with me in the hospital so that my mom could like go home and like take a shower and take care of the house and stuff, and she would spend the nights with me in the hospital. And she's a homemaker, so it was just really hard for both of them. But my mom's like a really good like at mothering me and stuff, so she was very good to me. But yeah, my dad probably had like the hardest time with it, and my sisters just tried to like spend time with me when they could when I wasn't like in isolation. But yeah, it was just rough on our whole family, and everyone was like freaking out about like wondering how I was doing and everything. But I felt really loved by them, so it was good. Anyone else? Hendon?
What do you want your friend to do to you when you have cancer? Like, what can we do to help? Like, our friends if someone had cancer.
Mm-hmm. Well, I had a lot of friends that like were praying for me, and like I couldn't like see people very often. Like a lot of people like wanted to come visit me, which was like really nice, but I had like a very small window of time in each cycle that like my blood cell counts were actually to the point where I could see people. So yeah, people did come visit me, but a lot of people just, it meant a lot to just have people like ask how I was doing and everything and like reach out to me. I think that made me feel like really loved, that they were like thinking about me like day to day. Rachel?
What were some of the other programs that your hospital did that helped you out besides the beads? I know you talked about the pillowcases.
Oh yeah, so there was this guy in my sister's grade in high school, so he was 3 years older, and he started this organization called Conquer Cancer, which where you donate pillowcases that are in like colorful patterns and everything for kids with cancer. And so he actually, when I was a freshman and he and my sister were seniors, he passed away from like an osteosarcoma, I think, that he had had cancer for 5 years that just kept coming back, and he had to get like his leg amputated and everything, and he eventually, when he turned 18, chose to like be taken off treatment for it and just to pass away. But his mom still like keeps on with the organization. And when I was at my hospital, they ended up giving me a pillowcase, and I still actually slept on it like last night. But it was just really special to me to have like that connection like to him and everything. And then one thing my social worker set me up with is the Make-A-Wish Foundation, and they actually granted my wish. The following summer, I ended up going to Durango, Colorado to go to like a horseback riding ranch for a week, and it was like all expense paid by them. And that was just amazing because, like as I said, like the previous 4th of July, I had spent it like stuck in the hospital, and then I got to go home, but I like had to be in isolation in my basement while my everyone else was at the fireworks and stuff. But when I was in Colorado, I was there over 4th of July, and I ended up getting to see like the fireworks being set off of like a boat that was in like on a lake in the plateau in the middle of the Rockies. And I got to see like the fire, like lay by the lake and then see like the fireworks like reflecting off like the mountains behind them, like over the water. And it was just like such an amazing like difference for me from the previous year. So I like, that's like the most special vacation I've been on. So I really love that organization as well. Leukemia Lymphoma Society was also good too, but Make-A-Wish Foundation was probably my favorite. And the Beads of Courage, of course. Shell?
You said like when you got radiation, they like they tattooed you. Like, could you like explain that a little bit more? Like, what did they look like? It looks like
Oh, they're just little dots.
Oh, okay.
So like it was done by like a nurse in the hospital. When they were actually like making this mask and they were like holding it down in my face and waiting for like the plastic to dry, they also were like, okay, we're gonna give you your tattoos now. And so one nurse came and just like poked me a few times with a needle and like spread ink in it and did that on like both sides of my chest too, as well as the middle. Anyone else? Well, thank you guys so much for supporting.